Nirsevimab, brand name Beyfortus, is a long-acting monoclonal antibody that provides passive immunity against RSV. It is not a vaccine, but because it is being used in a manner like routine childhood vaccines, you may hear it being referred to as a vaccine. Efficacy data show that nirsevimab decreases the incidence of RSV-associated lower respiratory tract infections requiring hospitalization or urgent care, primary care, or emergency room visits by about 80%, and ICU admissions by 90%. Clinical trials have also shown that nirsevimab is well tolerated, with a safety profile similar to placebo. It is recommended for all neonates just before or during their first RSV season if the mother did not receive the RSV vaccine Abrysvo during pregnancy, the mother's RSV vaccination status is unknown, or the infant was born within 14 days of maternal RSV vaccination, as they would not have mounted an adequate immune response. In other words, if the neonate was not born more than 14 days after maternal RSV vaccination, administer nirsevimab. However, it should be deferred if the neonate is moderately or severely acutely sick. Nirsevimab is given intramuscularly and can be administered at the same time as routine vaccinations. It is given as just one dose per RSV season, which is typically considered to be October through the end of March. In infants born during RSV season, nirsevimab should be given within the first week of life or at hospital discharge. Infants born outside of the RSV season should get it shortly before the season starts. Nirsevimab is also recommended for high-risk infants just before or during their second RSV season, regardless of maternal RSV vaccination status. This includes infants who would have previously been candidates for palivizumab or Synagis, as recommended by the American Academy of Pediatrics. So, those less than 29 weeks gestational age or less than 32 weeks gestational age requiring more than 21% oxygen at 28 days postnatal age, and those with hemodynamically significant heart disease. The CDC's Advisory Committee on Immunization Practices and the American Academy of Pediatrics add American Indian and Alaska Native children to the high-risk list for nirsevimab. They also expand on the bronchopulmonary dysplasia Synagis criteria, recommending that infants with chronic lung disease of prematurity who required chronic corticosteroid therapy, diuretic therapy, or supplemental oxygen at any time during the 6-month period before the start of the second RSV season are indicated for a second dose. Severe cystic fibrosis and severely immunocompromised status are also included in the high-risk category for nirsevimab, which were previously question marks for Synagis administration. They define severe cystic fibrosis as having a previous hospitalization for pulmonary exacerbation in the first year of life, or abnormalities on chest imaging that persist when stable, or as having weight for length less than the 10th percentile. In hospitals that have not yet been able to obtain a supply of nirsevimab, Synagis should be administered to high-risk infants in accordance with the American Academy of Pediatrics Synagis criteria. Nirsevimab is manufactured as 50 mg and 100 mg pre-filled syringes for single use. Infants weighing less than 5 kilograms should receive 50 milligrams, and those weighing 5 kilograms or more should get 100 milligrams. Infants indicated for a dose during their second RSV season should receive 200 milligrams as 2 100 milligram intramuscular injections. The preferred site of administration is the anterolateral thigh region. Topical Emla cream and oral sucrose or oral dextrose 25% can be administered prior to administration to prevent pain associated with the injection. Thank you for watching. My references can be found in the video description. Please let me know in the comments what topic you'd like me to cover next.